Unimed Teaching Hospital, Ondo was established as a platform for training, research and clinical services with an amalgamation of 7 hospitals in fulfillment of the desire of successive governments to make the state a medical tourism destination. That informed the visit of members of Ondo State House of Assembly Committee on Health led by its chairman, Dr. Christopher Ogunlana, to the hospital. The chief medical director of the hospital, Dr. Oluwole Ige, while appreciating the lawmakers for the support over the years, informed that the teaching hospital has been a training hub for medical students of University of Medical Sciences, Ondo.
In collaboration with the university, we've been able to produce 2 sets of medical doctors, then several sets of nurses, medical laboratory scientists, physiotherapists, and many other health allied related courses. We've also trained and graduated postgraduate doctors, fellows who are specialists in various fields of medical profession.
Dr. Ige, who lamented the deaths of medical personnel in the hospital, appealed to the lawmakers to help provide solutions to brain drain in the state. The committee chairman, Dr. Christopher Ogunlana, noted that the University of Medical Sciences Ondo, being the first medical school in the country, is the pride of all.
To thank the management team from both the service and the graduates at record time. It's not easy in the medical school. Because I've college the university in those days. I've seen spend almost 10 years before the medical and dental council had full approval of the university to produce graduates. So having achieved that, we also thank the government. If we have no support, the government has not supported to get the necessary facility or grant, the medical and dental council will have approved or accredited the courses to produce medical doctors. So it's a good route and we thank our government for doing that.
The really born medical doctor, who said the House is not unaware of the rate at which medical personnel are leaving the country in search of greener pastures abroad, stressed the need to work out modalities that will help retain Nigerian trained medical personnel.
And we also know what is happening now. Medical doctors or medical personnel in Nigeria. This is a Japa syndrome. It's ravaging the whole country. Now, maybe we also have to look inward so that we can retain our doctors. And the primary cause is welfare.
Other stakeholders at the meeting expressed confidence that the visit would bring about development in the teaching hospital. The lawmakers also conducted a tour around the facility. Omoshiliola, Adesoye Ajayi, Always House News.